Would you think I'm crazy if I told you that any kind of bursitis and any kind of tendinitis is actually just a symptom and not, in fact, a diagnosis? Because at the heart of it, all it is irritation of a tendon, right? So tendinitis is irritation or inflammation of a tendon. Bursitis is inflammation and irritation of a bursa, which is because of a tendon that is on top of it and just rubbing on it and creating that irritation. And a lot of times it could happen because either there's an issue with joint mobility, right? So if your joint isn't able to do what it's supposed to be, what it's designed to be doing, that can cause irritation through other muscle groups, right? We need to retain our mobility through all the joints. It could also just as easily be a weakness around the area, and you feel it through some specific tendons, which cause, whether it's tendinitis or bursitis, but you feel it through certain muscle groups over others, and that's what causes the symptom of the problem. But the problem itself is the bigger picture, where maybe it's muscle weakness, maybe it's nerve compression, maybe it's joint immobility. And once you can identify those things, that's how these things go away really fast. And things like plantar fasciitis are exactly the same. Plantar fasciitis, people deal with it for so damn long. Meanwhile, it is really easy to fix. And it's not by rolling on a frozen water bottle or a cross ball or just stretching the bottom of your feet like crazy. It's a lot more complex than that. You have to look at the bigger picture, because if you don't, this is why people stay in pain for too long. Bursitis, nobody should be dealing with that for longer than a couple months maximum. Tendinitis, nobody should be dealing with tendinitis for longer than a couple months maximum. Plantar fasciitis, no one should be dealing with that for longer than 2 or 3 months maximum. And yet I'm coming across patients who are dealing with these issues for months and months and months or even years. And it is crazy. There's a reason why monster walks and clamshells aren't fixing your trochanteric bursitis. There's a reason why holding a band and opening and closing the arm like that isn't working for your rotator cuff tendinitis. There's a reason why all these things don't work, and it's because they are just trying to patch up the symptoms and no one's actually looking at the bigger problem. So next time you go to work with a medical provider, a therapist, whatever, are you sure that's the problem? Ask them that. Are you sure that's the problem, or is there something else? Is there something else that could be contributing to this issue? Because a lot of times it is. And a lot of times people go through the medical system a lot longer than they actually have to.